who am I sometimes can be a selfish question. I'm just searching for myself. The true question, and it is responding to the question of what drives, is whose am I? Because the whose am I gives me an umbilical cord, it gives purpose to my life.
Hi, and welcome to Indian Explorers. In this podcast, we talk about Indian success stories. I am Sabrina, and together with my co host Amit, we will get to understand the journey of our guests and what drives them. The optimism, patience, idealism, and courage, these are their attributes that we want to bring to life in our conversations with them. So if you enjoy the show, please hit the subscribe button and share it with others. Good morning. How's it going?
Good morning, Sabrina. How are you doing today?
I'm doing well. Well overall, but I'm at that age now where you just move, do a little sudden movement, and I tweaked my neck yesterday,
Oh,
and I'm in so much pain. Like I
massage
can't,
or
I can't
how?
look that way.
I get that a lot.
Oh, I
Yeah,
guess it's
hot
gonna keep
water,
happening.
deep
Yeah.
heat. Yeah.
Yes, I need to do that if I have time. Right, just keep running around. But hey, you just got back from vacation. What's up with the tropical shirt? Going on
Oh,
another vacation?
no, I was feeling FOMO. I think Mukesh and Nita must have got my address wrong for the pre-invite for their pre-wedding. They
Pre-wedding
had
celebrations.
I had the outfit ready. They had that jungle party.
Yeah.
Was one of the themes. As Anand was talking about his animal conservation project. So I thought I'd get an invite, obviously, for this pre-wedding
Yeah,
party.
of course. I mean,
What did
you
What did
did
you
play
think of it?
soccer with his brother, right?
No, that's also true.
Yeah.
What did
You didn't even try to get the invite when you were playing football with him?
I didn't even know they were getting married, Sabrina.
I know me neither.
I mean, I didn't even know who Radhika is. Sorry, Radhiki, according to Rihanna.
Yeah. Yeah. What
Uh,
did she? Radaka. I think she said Radaka.
I don't know, but if you're getting paid $7-8 million
Yeah.
for less than an
You
hour
better get the
concert,
name right. You better
yeah,
get it.
it's
What did I think of the wedding you were about to ask? Or the pre wedding celebration? You know what? It's not my money. People spend it the way they want. It's over the top, but if that's how you want to spend your $118 billion, that's your call. Um, I did look them up yesterday. I did not know about the $1 billion building.
oh, Attila,
It's like the
Antila.
most Antila, the most expensive private residence in the world. I don't find the building to be nice looking. Have you?
The location,
Uh
Sabrina,
huh.
it's Altamont Road, and that's one of the prime real estate locations.
Okay.
So, with the value of the land, you know, it's 600 employees.
In
They've got
that private residence?
yeah,
Wow.
yeah. I think they're like 4 or 5 people staying there. I think they, I think when they moved, they hadn't even moved in, and the electricity bill was like over $100,000, and they hadn't even moved in yet.
That's insane. What did you think about the pre wedding? At first, I thought it was the wedding, and then I saw it was pre wedding celebration.
I was very impressed with everything. Everything. I loved what the couple was wearing. I loved the shows. I loved the performances. I loved how they got the three cons together on the stage to dance.
Mm-hmm.
The who's who of Bollywood was there. I liked the fact that, before starting the festivities, they went early to Jamnagar. I like that it
Mm-hmm.
was in Jamnagar, in a
Yeah,
city in Gujarat, uh, which nobody knows anything about.
right.
Uh, Obviously, I think that's where the Reliance largest oil refinery
And
is
Nita
there.
was born there.
Also, was she born there?
Yes.
Oh,
Mm-hmm.
okay. So I like the fact that they fed 51,000 people, the locals, before
Mm-hmm.
the celebrities, before the famous people came in. I like the fact that Nita Ambani, in one of the speeches, said, "Thank you." Not she didn't mention the names particular, but obviously Zuckerberg and Bill Gates and Bob Iger of Disney,
Our
and
fellow billionaires.
yeah, our friends were all there. But I like the fact that she said that, thank you all for, coming here to bless us. and the
Hmm.
fact that you couldn't Google the photographs of the hotel that you were going to stay at, I thought that was quite funny of us.
Yeah. So let me ask you, they brought so much money to that small place in Gujarat. What do you know about their philanthropy? Like, do they give a lot of money? They're
Um,
not, I don't feel like they're like the Tatas.
I think they do a lot. I think just from a model of capitalism, the amount of employment they provide in India, the amount of people, whose families, the incomes that they pay.
Hmm.
Uh, One thing I will mention, I don't know exactly in terms of they have hospitals, they have schools,
Yeah.
they
Because what
have the
you're saying,
animal.
like employing is, and I know Mukesh Ambani has said that, like, I employ half of India. So that should be enough. But that's part of your business, right? What
I
about
mean, I
just
think
giving freely?
uh, I don't know. I haven't
Yeah.
done any homework
That's
on
something I look at. And I brought that up because last week, um here in the US in the Bronx, Ruth Gottsman, a philanthropist as well, gave the largest US medical school donation of $1 billion. And if anyone has seen this, if you haven't, look it up. It's pretty impressive when they announced that,
I saw the kids
medical school
celebrating.
tuition is going to be free for those students from there on out. And I mean, I was just blown away by how giving that was. And she was a
Yeah.
professor there. I think she's the chairman of the trust there. But to give $1 billion to a medical school in the Bronx, it's a huge, huge deal.
I enjoyed the video because I see
Mm.
all these brown, Asian, white
Yeah.
people all sitting, looking at each other like this, bored. And all of a sudden, with the announcement, all
Yeah.
of a sudden, it's like they're all drunk and
It was
celebrating.
amazing.
Yeah, it was a good one.
Amazing, right? And I'm not saying, I'm not saying that the Ambanis don't give. I actually don't know how much they give,
You know
or to
what?
what causes.
Can I? Something I know for a fact. Mukesh and Anil Ambani, their father is basically their role model. His name was Dhirubhai Ambani, and he came from nothing.
Hmm.
He got into textiles with, I believe, his second cousin, and
Yard, sorry, yarn trading, right?
yeah. So basically, he got the rights to for polyester
Okay.
for India, and back then polyester wasn't there, and then all of a sudden it became a big thing, and textiles, and he made money with that. And then he got into other industries like telecoms and oil
Yeah.
refinery and petrochemicals, etc. But what he did do, unlike other Indians, he actually believed in the equity markets, the capital markets. So when his Reliance went IPO, it was,
Hmm.
I believe, one of the first times where retail investors, i.e., the individuals, could actually invest and own stock in Reliance. And
Okay.
so, I don't know in terms of philanthropy what he does, but the fact that he was an innovator for India, for me, he was the Steve Jobs plus Bill Gates plus Henry
Of
Ford
India. Yeah.
of India.
Yeah.
So the only thing that obviously he gets a lot of slack for is that he didn't do a will. And ultimately, when he passed, I think it was his second heart attack, the two sons could not agree on you know the fortune that the father had built for them. And then the
Hmm.
mother got involved, and I believe the brothers didn't speak for a decade or whatever it was. And ultimately, it led to Mukesh's younger brother Anil's downfall, who is now, I don't know if the word is broke, but basically he owes a lot of money to
Who's
banks.
not as rich as his brother.
Yeah, 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 yeah. I didn't think he was at the wedding, but I actually saw him come back from the wedding.
Oh,
So
okay. That's
yeah,
good.
yeah. But yeah, I think I think Nita Ambani is Queen Elizabeth
Yeah.
reincarnated. I mean,
She's pretty cool. I do like her. Look, I did say, I think it's a pre-wedding celebration. It's over the top, but let's be honest. If I would have gotten an invitation, somehow I would have been on the first flight to India. I think it seemed like a fun time.
did you see that necklace she wore with those big emeralds?
Yeah.
Yeah,
Yeah.
apparently that was $16 million.
That's insane amount of money.
Now, if
So,
you're wearing
okay.
that for a pre-wedding, how do you beat that? Did you see the cake? The cake that came on?
No.
Oh, you didn't see
No.
the cake?
No.
check out Anand Radhika cake on
So
YouTube.
what is, oh my gosh.
It's like three people.
I wonder
You know,
what
it's
they're
a
planning for the wedding.
I don't know, but we got to become friends with them by then, Sabrina. So one
We
of
have
us
a
gets
few
invited.
months. So, okay, the irony is that, I was doing a lot of research for our guest today, Dr. Anand Bang, and um, yeah, the life and the lifestyles couldn't be any more different.
I wonder what he
I
thinks
think
of the
their
wedding.
approach to life and giving to people seems to be total opposite sides of the spectrum. So, I am looking forward to speaking to him and, yes, seeing what his thoughts are on
Yeah,
the
me
Ambani
too.
family. Yeah,
By the way, before we bring on the guest, I was quite impressed with both the bride and the groom. I thought they spoke well.
I
They both
agree.
seemed totally in love. I thought Anand was very charming in the way he spoke.
They
I
seem
thought
very
Radhika
grateful
very
and
humble.
gracious. Yeah,
I thought Radhika looked stunning,
yeah.
and just you know, really, I'm rooting for them.
Oh, of course. Wouldn't root against
Yeah,
them. The only person I root against is someone here in the US, and I'm sure we'll talk about him in the near future because it's campaign season.
yeah. I
We'll
actually think
talk
Trump's
about
gonna
that in a
win.
future episode.
I think Trump's gonna win, even if Taylor Swift says these words. Hi, I'm Taylor, and I'm voting for Joe Biden, and I want all the Swifties to vote for Joe Biden. I think even that will
Yeah.
not stop with what Biden has done with the migration policy. I think America's had enough with Biden, not to mention his age.
Well, immigration policy, I disagree on that comment. But for the first time when it comes to US politics, I agree that unfortunately, I think Trump's going to win as well, even if Taylor Swift comes out and says vote for Joe Biden. But the immigration policy, we'll go back and forth. So let's save that for another day.
Sounds good.
Yep. All right, let's bring on our guest. Okay, so I'm thrilled to introduce Dr. Anand Bang, graduate of Johns Hopkins, sits on the Executive Committee of SEARCH, which is the Society for Education, Action, and Research in Community Health, a nonprofit of Maharashtra, founded by his parents, Dr. Rani Bang and Dr. Abe Bang, in 1986. Dr. Bang is the advisor to the Deputy Chief Minister of Maharashtra and also an advisor on health with Tata Trust. So, thank you so much for being here today with us. We're
Thank you.
excited to
A
talk to
joy.
you.
A joy, of course.
Hi, Anand. Welcome to the show. How are you?
Very well and excited.
Yeah. Anand, I'd like to begin. In the introduction, Sabrina and I were talking about Anand and Radhika's wedding, pre-wedding. And I wanted to get your thoughts, since you live in India, what was it like? What was the buzz like? What are your thoughts on, the money spent and the Ambani family in general?
Well, I personally am very clear. I think it is inappropriate for India, is my personal value and opinion. Of course, everybody has personal choice, so that is up to the family and of course the individuals. I have different value system. Second, I think beyond the individual, who of course have their own right, the media going completely berserk, completely ignoring the challenges in India at the moment, I think was one of the most idiotic thing one would have seen in last. Well, I think it is not so idiotic. We see it quite frequently nowadays, so not really so
Yeah.
unexpected.
Got it. I appreciate the honesty. I live far away. I enjoyed it. I enjoyed the wedding. They seemed like they're genuinely in love with each other. And for me, the Ambanis have the money. I believe they provided, the multiplier effect in Jamnagar. And obviously now it's going to become a tourist destination. But I totally get your point, and I appreciate you answering it honestly.
And I said I thought it was over the top, way too much. But if I were invited, I would definitely go.
All right,
Let's
let's
get into your story now.
Yeah,
Yeah.
yeah. Give
Yes.
us the background. Where were you born? Your parents, your upbringing. How was that? How was your childhood?
So I was born technically in Nagpur, but I mean, essentially the journey traces back to my grandfather, and his association with Mahatma Gandhi. My grandfather came from an extremely poor family in the western Vidarbha region of Maharashtra, the region which is very unfortunately well known for farmers' suicide. Somehow, in that very poor region, he turned out to be a brilliant student. Nagpur, which is the 0 mile of India, central city at that point, was the capital of the pre-independent central province of India. He set a record of gold medals, so many that university had no more gold medals to award him. And somehow Mahatma Gandhi and Jamnalal Bajaj came to know about him and identified him as a professor to teach in a college started by Jamnalal Bajaj in Wardha, where Mahatma Gandhi was living in his Sevagram ashram. That's how he got introduced to the Mahatma. Then, of course, 1942, Quit India movement. So he joined Quit India. He went underground. He was unfortunately betrayed. So he was arrested, went, spent days behind the bar, broke the jail. Unfortunately, was again arrested. And then he came out of jail near around the independence of India. He wanted to do PhD in economics, so he got scholarship, visa, everything for PhD in economics from Ohio State University. And as he used to tell us till his last days story, he went to meet Mahatma Gandhi in the Sevagaram ashram where Gandhi used to live. Now, this ashram was unique. Gandhiji had put a condition that my house should be built only using material available within 5 mile radius.
How many mile?
Five
Five.
Five
miles.
mile radius.
And Ivan
So how old
Illich,
was Gandhi at this age?
Gandhi was
What year are we
about
talking about?
this year 1946, so 77.
Mhm.
And Ivan Illich, one of the great Brazilian thinker, he actually calls Bapu Kuti, Mahatma Gandhi's house, the greatest architecture of 20th century. So my grandfather entered the hut. Gandhiji's appointment time used to be very interesting. 2 minute, 3 minute, two and a half
Oh
minute.
wow.
The man was living in the de facto capital of pre-independent India. So my grandfather enters that hut. Gandhiji was sitting on floor covered by mud and everything, was writing, looked at my grandfather, asked in Hindi, of course knew. So tell me, Professor Bang, how have you come? So my grandfather tells him, I want to study economics, solve the agrarian economic issues of Indian farmers. So I want to go to the US to study economics. And I have come to seek your blessings. Gandhiji looks at him for a few seconds and then utters a single sentence in Hindi, in English. If you want to learn economics, go to the villages of India. That's it. Nothing else. Nothing else. Then just starts writing. My grandfather comes out of Bapu Kuti. Then and there, in front of that Bapu Kuti, he tears away passport, visa, scholarship, every travel document. And straight
He didn't go to
away,
America.
he did not go to America. Straight away, with his economics students, he starts living like a farmer in a nearby village, daily coming to the college to teach as a professor, but surviving only on the income as he would earn as an Indian farmer.
That line from Mahatma Gandhi changed the trajectory of your family.
And I asked him, we used to ask him why. What was the magic in the old man? One line,
Hmm.
one line. He
Yeah.
said, when Gandhiji asked me to go to the villages of India, he was living in the village of India in a hut under 47 degrees Celsius central Indian temperature. So if there was a magic of Mahatma, and there's a story around that. Ramana Lohia, another great patriot of India, asked Mahatma Gandhi, why is it that we speak such a fiery oratorial language, and look at you, you speak such poor Hindi, hardly any power in that. People of India listen to you. What's the magic? Gandhiji said, people of India know that I have never ever asked them to do anything which I have first not done in my own life.
Hmm.
He led.
So this
He led. He's a leader.
he led. So the lesson is go where the problems are and not where you end up becoming a problem.
Yeah.
Uh, I mean, I wonder what Gandhi would think of Mukesh Ambani and Modi today. Anyway, sorry, that was a bad joke. Let's uh, let's talk about search,
So my father,
Yeah.
Anand.
my father
Yeah.
studied in that Sevagram ashram of Mahatma Gandhi in a school jointly started by Gandhiji and Rabindranath Tagore. This was the Nai Talim education system. Gandhiji at one point said, India can forget everything that I have said, just remember the education system which I have given. What his point was, we in education, the usual education is first education, then life. So lifeless education and zero intellectual subsequent life. There's a dichotomy between education and life as we live. He removed the dichotomy. Gandhiji believed what is in Hindu philosophy called Advait Vedanta, integrate everything. So Gandhi said education and life are not different. Education is life, and then one step forward, life is education. By living life,
Dr. Anand,
yes,
sorry, I was reading about that, the Nai Talim
yeah,
education,
yeah,
and to me it seemed like in the US we're doing it all different, right? Because let me read what the principles are. The first principle, to become a whole person using head, heart, and hand, right?
mhm,
The second principle, children should learn by actually doing and living.
exactly.
The third principle, learn a socially useful, productive activity and engage in bread labor. And the fourth principle, ethics and moral values.
So true, so true, so true.
So true.
So
Yes. And hands on,
And
live
absolutely,
life.
Gandhi believed in Tolstoy, the bread labor concept, and that's a beautiful book.
Okay.
So Gandhi fully believed in that. So my father studied in that school, and my grandmother was the principal of that school. So at the age
Mm-hmm.
of 14, my father decided, and and my uncle, his elder brother, that now let us decide the path of our life. 14-year-old, 17-year-old. So my uncle said that, okay, India has agrarian crisis. So I will, it was 1960s. So I will take up the agriculture, and what is remaining is health. So you become a doctor. India has health crisis. So that's how the trajectory was set. And then subsequently, of course, he met my mother, both studied medicine, subsequently public health in Hopkins, and then returned to India. And we listened to the first lesson of Mahatma, go where the problems are. And Gadchiroli is where if we throw a stone, we hit a problem. There is zero dearth of problem here. And that's why we have come here. It is a tribal district affected by Naxalism, left-wing extremism, and one of the remotest former forested, beautiful district. And there we are working. So that's how we landed up in Gadchiroli.
Can you tell us a little bit about the actual project? How is it funded? Any accomplishments or milestones that you've achieved?
So, Society for Education, Action and Research in Community Health. We serve the local community. We train community health workers to international policymakers. We do very meticulous research on population-based problems of Indian community, and we try to influence policy using the research, and sometimes we also take up the approach of confrontation. So these are the four approaches that we follow. What are the specific programs? We have a 100-bed hospital, about 45,000 patients from 2,000 villages across Gadchiroli and the adjoining district. Tribal healthcare program in 230 villages. Mobile medical unit. Life skill education and reproductive sex health education for tribal and rural and semi-urban youth. Mental health care problem. My sister-in-law turns out to be the only psychiatrist currently in the entire Gadchiroli district, 1.2 million population. So, providing mental health. Substance abuse, tobacco and alcohol is a huge problem. How huge? So, in 2015 and 16, there was a district sample survey of the district. We found that the district development budget was about 170 crore rupees, and the out-of-pocket expenditure on tobacco and alcohol was 350 crore rupees. So, huge burden. We have Nirman, which is creating young social change maker. We have Mother Newborn Child Care Program, which is one of the most internationally renowned program of search. The infant mortality in Gadchiroli, the villages where search works, has been brought down from 121 in 1988 to now around 70.
Can I just go back to? I mean, these are obviously incredible achievements. and vast projects, which has been done over decades of work. Who's funding this?
Ah,
I mean, are these
yeah,
donations? Is this a for-profit initiative? Just want to go through the money a little
right.
bit.
So completely non-profit. The donors are
Non-profit.
multifold, Indian as well as international donors. Indian foundations like Tata Trust, Azim Premji Foundation, Rakesh Jhunjhunwala's
Got it.
foundation. Then we have CSR to the corporate social responsibility. We have international donors, so MacArthur Foundation, Gates Foundation to Saving Newborn Lives, Rockefeller Foundation, Oxfam, etc. And individual good Samaritan citizens. So these are essentially the four ways we get funding. The user fees is extremely minuscule. We clearly believe that healthcare to the tribal and rural people of Gadchiroli and India has to be subsidized. There is no second way about it. It cannot be
Sure,
self-sustainable very clearly. So the non-profit
but
clearly
not
that's it.
free.
Well,
It's not free. It's
majority of it is free. Just to take a financial, the hospital, which serves, as I said, 45,000 patients, the annual budget is about 5 crore and income is about 45 lakh rupees. So less than one tenth of the actual budget. It is notional
sure.
only as a registration fee, 20 rupees, something like that.
Okay. I was fascinated to read the first few research projects your parents did with search,
Mhm,
and I'd like to learn more about where that is today. One of them was
mhm.
um the gynecological um challenges that women
Right.
faced. It said that 92% of the women in two villages suffered from gynecological problems when search was founded. What do you think the percentage is today of how many women
So I'll
are
slightly
dealing with
go
that?
back and point the research component. See, frankly, NGOs do not necessarily do hardcore population-based research. The dictum that we follow in search is one accurate measurement is infinitely superior to thousand intelligent opinions. We Indians have
Okay.
opinions on every damn thing, from what should happen in the marriage to who should be the next US president, generally wrong opinions. So we believe data is what really matters. So focus on measurement and nothing else. Challenge ourselves based on data. That's how the research approach, in addition to service, comes into picture. Now, the Gynec study actually was a very interesting. Another lesson of search is listen to the people. Time magazine, when it did a story on search on the 18 global heroes of health, the caption on the story of search was the listeners. We public health professionals, and actually I will go beyond that. A lot of development professionals, as Professor Carl Taylor from Johns Hopkins used to say, are like children with a key in their hand trying to fit that into a lock. We have ready-made solution. We are just finding the problem. The true development professional or change maker begins with the problem and then designs the key. That comes only from listening. So now this women's health issue came up. Look at the background before that. Till 80s, women's health in India was equated to only one thing, family planning. As if what a woman does only is having children and the only healthcare program should be family planning. That's it. Now, my mother spoke with the women of Gadchiroli. My mother is a gynecologist. She performed the first cesarean section in this district 1986 June. And my childhood memories are of my mother. Every night, at least 4 times, she would wake up, she would go to the civil hospital, perform Caesar, come back. At that time, blood donation, people were very skeptical of blood donation. So if a woman, a wife, is going into labor, requires Caesar, and my mother would tell to the husband she requires blood. The husband would come back. He would give 50 rupees in the hands of my mother. He would say, go and purchase a goat, take the blood from the goat. I am not giving my blood or anybody's blood. So my mother, many cases, she would do blood donation for the patient and then she would operate upon the patient. So I think the courage and the example and those childhood memories essentially what shape you. I think the best thing parents can do is not to preach, just be. Children are adequately intelligent. So my mother spoke with the women of Gadchiroli, asking them two simple questions. List your 10 most important health problems and rank them. Women of Gadchiroli did that. And they ranked infertility and obstructed labor as their two most important health problems. My mother was perplexed. She asked them, Ki obstructed labor, I understand. In a district without any cesarean facility, obstructed labor almost means certain death for the mother. Why infertility? No one dies in infertility. Women of Gadchiroli, what a beautiful answer they gave. They said, Madam, if a woman has obstructed labor, she dies once. If she has infertility, she dies daily. Society will not let her
Oh.
live, will stigmatize her. So my mother then did this study in the villages. Hey, what are these health problems, gynecological issues of the women, far beyond just a reproductive career? And that then led to that study of 92% women having one or more gynecological health issues, which was declared as study of the decade in the 1980s.
I read that.
Change,
That's fascinating.
change the entire discourse of health from maternal health to reproductive health. Entire reproductive career of women must be taken care of, and ultimately led to the Cairo Conference on Women's Empowerment. So, coming back to your question also, Amin, as to what was the some successes. Listen to people, use power of data, meticulously study, publish, use it for policy, change global discourse. I think that case study came out to that. Your
Yeah.
question as to what would be burden now, that is a great research question. And unless we do second study on that, as I said, one
Yeah.
accurate measurement is superior to my opinion. So I will wait till that.
Okay. There was another one about the infants who had pneumonia, and it was so expensive to buy. You would need, your parents said they needed x-ray machines, and how are they going to buy them and then have them come to this village? And they developed a system that the midwives used where for every certain amount of breaths you would slide a bead, the bead
Yeah.
system. And that was another research project that is very well renowned in the medical industry. And I mean, honestly, reading about you and your family, I've just been so fascinated. I think it's,
I
yeah,
didn't
no,
understand that.
honestly, that you've
I didn't
changed
understand the
lives.
beads. I didn't understand the
Yeah.
beads thing.
Oh, can
Can
you
you
I'll
explain
explain
do.
the
that?
beads to
Yeah.
anyone
So,
listening? Yes.
children's death, childhood pneumonia is one of the most important cause of death. Frank Shan, an Australian medical student, found out that in the absence of X-ray, how do you diagnose pneumonia? And a majority of the tribal rural areas don't have X-ray. So an equation emerged that if respiratory rate, breathing rate in a minute is more than an X cutoff, then it can be reasonably safely assumed that the child has pneumonia, 50 or 60, depending on child. So very simple. Measure the respiratory rate, and if it is more, then diagnose as pneumonia, give oral antibiotic. Number one. Number two, fair enough. So then who will measure the respiratory rate? Till no hospital. Until the child reaches the hospital, too late. So the empowerment part of search, the belief that 80% of health problems can be managed in the primary care using the human potential in the villages. So we trained community health workers and traditional birth attendants in measuring the respiratory rate, diagnosing pneumonia, and giving antibiotic. The bead abacus, where it come into picture, now these traditional birth attendants were illiterate. They could count only up till 10, and counting had to be done up to 50. How do we train them? So we designed simple abacus, 1 minute sand watch, and five beads. And the sixth bead is the red one. Before the sand watch 1 minute is over, if after each 10 counting, the TBA would move one bead. First, second, 1, 2, 3, 4, 5, 6, 7, 8, 10, second, third, fourth, fifth. And if using the abacus, if the final bead has to be moved, it means the child has pneumonia. That became one of the first global field trial of diagnosis and treatment of childhood pneumonia in the villages, that reduced infant mortality from 121 to 80 within 2 years, became a global program, and it was launched in 77 countries of the world as Global Pneumonia Control Program. Again, same. Listen to people, identify the burden, find a locally empowering solution, train the local people, publish and shape the policy.
No, I need a moment, Sabrina. This is a bit too much for me. I always think your mother and my mother are like the best mothers in the world, and now I found
No.
Dr. Anand's mother, and we have a conversation to have with our moms, Sabrina, you and I. With what's happening with abortion rights now in
Mhm.
America, Sabrina. I don't know what states it's in, and then France putting it in the law, and then listening to the story, I'm a little bit taken back. So,
You know,
Sabrina,
Dr.
you go
Anand,
for
when
it.
you mentioned that you listen to the women and they said infertility, it's like a death every day. I went through that, here, and I mean, I had to hold back the tears when you said that. As someone, who struggled to have a child, wow, I can't imagine these women, and I have resources around me and they didn't, or they don't. So it's beautiful work. I have one other question. um Mahatma Gandhi said, if I was made the ruler of India, even for one day, I shall close down all alcohol shops in the country. Can you tell us about you as a
Yeah.
child protesting with your parents to
I've
ban
not heard that.
alcohol in the village?
See, I know alcohol in the US also is a very contentious issues, and then and
Of
the
course.
1920s, I think the entire prohibition. Well, there's a local context and there's a global context. We believe that exactly what happened in case of smoking with respect to alcohol, we are exactly on the same trajectory. It was glamorous, then it did not. See, in Gadchiroli, what did we find is that one, when the health work was started by my parents, village after village, when they would go, women of Gadchiroli, and what Gadchiroli women tell is the same story across the villages of India, and even in urban areas, slums, and even in, let us say, high-rise building. Women would say, forget everything else. Do something about the liquor problem of our husband, our son, our brother, our father. And then horror stories after horror story. My husband came drunk one night. There was nothing to eat. I could not cook anything. He picked up our child and threw the child in well. So women forced Search to take an action. There was an economic angle to it. The development budget of Gadchiroli, every single government paisa that comes to Gadchiroli in 1988 was 14 crore rupees annual. And the alcohol sale of the district was 20 crore rupees. Now imagine, this is the poorest district of Maharashtra, one of the worst in India, where people get 14 crore for development but end up paying 20 crore back on alcohol. Who owned the alcohol shop? Local political leadership. India had a tribal excise policy. Globally, it is known that indigenous people, US also, as I understand, Native Americans have the same problem. Indigenous people are at a very high risk of alcohol, substance abuse, addiction. So it was against the tribal excise policy. It was against development, against women's issue, against health. So we took up this issue. It was a massive democratic movement of 600 villages, satyagraha. People stopped alcohol sell and drinking in their own villages. Classic democratic movement. And then picketing started. One day in one picketing, it did happen that my grandfather, my father, me and my younger brother, all four had participated in the picketing and formally all four were arrested. So three generations of a family formally arrested. I always actually get that question the US visa applications ask. Has there been any criminal case against you? I always have that temptation sometime, but I just
Oh my God. How old
I
were
was
you? How
so I
old
got
were you
arrested
that
three, four
time?
times. It was 12 and 13. And my
But it's not in your. It's
No,
not
no,
in
no,
your
it is,
criminal.
of
It's
course,
not in
of
your.
course not. But formally, it is a
Yeah,
classical
yeah,
satyagraha
Yeah,
thing.
you're like, did I put yes or no?
yeah.
Yes or no?
So that's how then prohibition was introduced in Gadchiroli district in 1993, and that's how the story was. Then we have continued to work upon that year after year. So prohibition is only one part, as we believe. Changing people's behavior, de-addiction, community enforcement. See, the global burden of disease, the biggest research study, clearly identifies tobacco and alcohol as two of the most important risk factors globally of death disease visibility. WHO and Lancet have come up with a clear statement. The statement is the only safe limit for alcohol is zero. So alcohol is the modern plague and cholera. So that has been our position, but I guess that can be a separate podcast on the issue of alcohol entirely. The
Yeah,
economics,
I'm
women's
sure.
issue. American Journal of Economic Review did a study on Bihar prohibition. That journal article showed that as soon as the prohibition was introduced, violence against women dramatically went down. So these are the various
I can
connotation, and
imagine.
that has been our position on this issue.
So I mean, we've spoken about suicide of farmers. We've spoken about raping of women, especially with alcohol, linked to the partners, and infertility of women. Any other happy conversation? Any other happy topics that we need to discuss that search makes a difference in? Because I was expecting a fun podcast today. I don't know we're going to talk about such
No, I
serious
think
issues, but obviously all very
the
important
entire
issues.
story, I would put it this way: that yes, the beauty of Gadchiroli is there is a problem. Professor Gordis, one of the great of epidemiology from Johns Hopkins, he had come to India, and my parents, as young passed out MPS students who had done this work, went to meet him. And we were telling Dr. Gordis, we did this on childhood malaria, this thing pneumonia, we did XYZ on malaria, women's issue. After a few minutes of listening to his students' success stories, Professor Gordis had tears in his eyes. So my father was taken aback. He asked why. Professor Gordis said, look at you, young couple. I, in the US, my entire life I spent on one genetic disease. Look at you, you throw a stone, you hit a problem, you find a solution, you change people's lives. So I think the story is that how people, women, men, tribal youth, they coming together, solving their problem when empowered with knowledge. So we believe in that classic principle by Archimedes. Archimedes said, O king, give me a liver long enough and a place to stand outside the earth. I will move the earth. People laughed at him at that point. We know by the principle of liver, he was absolutely correct. We believe knowledge is exactly that liver. By the power of knowledge and people's own inherent strength, Indian people and across globally, we can solve their problem. So this, I would say, is a classic story of resilience and power of people.
I love that.
I love that too.
I have a question. What does, we ask all our guests this. What does success mean to you? Personally, professionally, all over. What does
We've
it mean
heard
to you?
professionally, I think, but
Yeah.
I want to know personally. I want to know what drives this
I
man.
can, okay. So again, Indian philosophy, there is a classic question. Koham in Sanskrit. The meaning is, who am I?
Okay.
What we realized from again family and others is that who am I sometimes can be a selfish question. I'm just searching for myself. The true question, and it is responding to the question of what drives, is whose am I? Because the whose am I gives me an umbilical cord, it gives purpose to my life. So I grew up here since 5.5 years old. I live in Gadchiroli. The children, the tribal rural, I have in my school friends. I have seen them, some of them getting killed in the Naxalite violence sometimes, and in the issues, problems day in, day out, and also their resilience and their love and affection. So I would say I am theirs. That umbilical cord is the one key driver. Second is, of course, the family in terms of the mission and values here. And third is unquestionably Mahatma Gandhi. And I'm extremely lucky to have been born in a family with direct connection to the Mahatma, especially when I see today's extremely disgusting discourse in India, utter lies peddled against Mahatma Gandhi. I think Indians don't deserve him. But of course, the man is not of India. One of the greatest, as Mountbatten said, he will go down in history on a par with the Buddha and the Christ. So, okay, India will again wake up maybe a decade later as to realize the man. So, I would say these three things. Fourth is, I would say, the intellectual and emotional adrenaline and challenge. Solving it. Every day one wakes up with a new problem to solve, someone to maybe help and get a joy through that. So I think that's what drives me.
I have to tell you guys. So after this, I'm going to a school to read a book and talk. And one of the slides, I have a question and it says, "Who are you?" And you just said, Koham, who am I? And it's a selfish outlook. And I tell you, after this podcast, I'm going to have a lot to reflect on.
Sabrina, you're gonna change the question now to whose am I?
Whose are you?
Yeah. And
Okay.
Sabrina, are you talking about reading your own book that you authored?
Yes. Yes.
You
Correct.
you missed that
Uh-huh.
part, Sabrina.
Well, you said I always try to push my agenda, so I was trying to stop doing that.
I, I
It's a
I'm only
children's
doing
book,
this
Doctor.
podcast. I'm only doing this podcast, Sabrina, to push you up.
Yeah,
That's the only reason why I'm doing this
yeah, I
podcast,
would
for no
love
other
to.
reason.
Dr.
Yeah, I
Anand,
was
I'll
just going to
send
say
you
that.
I'll send
Please,
you
absolutely
a
looking
copy.
forward to that.
Yes. To read to the
Sabrina,
children there.
Sabrina, do you have time for the rapid fire?
I do have time for the rapid fire. Yes.
All right. So, Dr. Anand, we're gonna just ask some basic, quick questions. If you can reciprocate with your, whatever
Mhm.
comes first on your mind. And Sabrina will start.
Okay. What is the last book you have read?
Actually, an interesting Ghost Flit. It is a book about an imaginary future battle between US and China. It was very heavily recommended, which is literally I finished it yesterday night at 2 a.m. So that's the one. And the second which I'm doing, huh?
Who won?
It was well.
Who won?
Well, I guess I mean personally, I think ultimately the balance was more in favor of the US.
So Trump beat Xi. All right, my question.
Yeah, and
Sorry, you had
that
a
is about
second.
course
I didn't
and
interrupt you.
judgment. A beautiful book by Arun Shourie about Indian course and judgment, path-breaking one in last again 50, 60 years. Again, looking at today's judicial system, I was keenly reading that. So these two,
Yeah.
What was the name of this book? The
court and
second one?
judgment, judgments of
Do you remember?
Indian courts. Yeah, yeah.
Court and Judgment.
Yeah.
Okay.
Does Gandhi have a biography, or like a Walt Isaacson type book,
So
written by
the
somebody? What book do you recommend by Gandhi for us to get the true
I would
history
say
of?
four books actually. One is of course his autobiography. Second is Satyagraha in South Africa, again by him. Number three, and this is actually very important, Hind Swaraj is a civilizational manifesto of Mahatma Gandhi. Extremely difficult to read and understand, comprehend. It challenges every single notion of our life. So one also needs to read a critique on that, but Hind Swaraj, this three, and two of the biographies of Mahatma Gandhi, Life of Mahatma Gandhi by Louis Fisher, and and another book by Rajmohan Gandhi, again the biography of Mahatma Gandhi called Mohandas. So this five would come to my mind.
Okay.
Well, great. If you had to have dinner with any of these four individuals, who would it be and why? Uh, Trump, Biden, uh, Modi, or Mukesh Ambani? Why are you laughing, Sabrina? Who would you like to have dinner with
I
of
would
these four
stay home
gentlemen?
alone. Send my husband and
I'm
daughter.
not asking. I'm
Yeah.
not asking you, Sabrina.
That's
Doctor
why
Anand,
I'm
I would
please.
laughing.
actually like to have a dinner with the Prime Minister Modi. Yeah, there's no doubt.
Modi.
One may agree, disagree, but there's no doubt
Yeah.
the
Yeah.
power and the impact and shape.
Impact.
So understanding, as I said, agree, debate, disagree is a different thing, but understanding is crucial. One cannot stay away from that.
He's he's from
There's
Gujarat as well,
he's from
right?
Gujarat.
Yeah.
Yeah. And what impact he's had on that state. Okay, Sabrina.
Okay. What would you want your legacy to be in one sentence?
That's a difficult one. That's a very tough one. Well, two words description has been exciting me. But those are such tall adjectives, or that sometimes I feel embarrassed myself that whether even aspiring for those. But I feel a satyagrahi scientist, if I can be known. So science and use of power of truth for making change, which a satyagrahi does. but also, of course, today's world, science is the key. So if I can combine those, so if I can be known someone who was this too, that will be, well, that will be the.
That's fantastic.
Okay. Uh, it's a good answer, but I don't want to end it, Sabrina. I'm
Okay,
enjoying
go.
this content too much.
I
Um,
know.
if what would you recommend? Uh, s- Something under 5,000 rupees, 10,000 rupees. What would you recommend everybody in India buy or consume or subscribe to for under 5,000 rupees that has made an impact in your life?
Hmm.
That would be actually book. So the multiple
Hmm.
books, it will come down to list of multiple books. It will be, of course, this two, three books of Mahatma Gandhi. It will be a book by Vinoba Bhave, another great Gandhian called Gita Pravachan. It will be Isha Vasupanishad. It will be Discovery of India by Pandit Nehru. So essentially books, books and books.
I take it you read daily. How much do you read a day? What's your
About
like
1 to
reading
1.5 hour
activity?
daily, 9:30 to 11 generally.
I tell my son every day. Every day I tell him. I don't know anybody who's not who's not
This
successful who
that
reads,
there's
I'm sorry, who doesn't read.
again a great point about Gandhi. Many people don't know this. When Gandhiji returned from South Africa to India, he had his personal library of almost 15,000 books. People feel as if Gandhi never read or something. He read voraciously, meticulously. He also did the next thing. He translated that reading into action. But even Gandhi very meticulously read. Every jail sentence, he would have his syllabus chalked out. What I'm going to study and read in during my entire jail sentence. So I totally agree with you.
I
Reading is
think I'm going to
meeting
change.
those. Reading
Yeah,
is
sorry,
meeting
carry on.
those whom you cannot otherwise meet.
Yeah, that's
Yeah.
true.
I think, Dr. Anand, we're going to have to change the episode from your name to Gandhi's episode. Yeah. Sabrina, do you have a last question?
I, I don't. Do you?
I have one more.
Go for
I
it.
have one more. I have one more. I want to end with something. I mean, listening to your mom story, I have you up there, like, above my mother, which is like impossible for me. So I'm trying to find something bad about you. So maybe tell me a bad habit that you have that you're trying to get out of, but you failed to do, just to make sure that you're like normal and human. I'd like to
No,
end. I'd like to
I
end
have
there
plenty
with my
of bad
negative
habits.
thoughts.
So at times, yeah, at times,
Tell us about them,
sometimes
Dr.
I
Anand.
do
Tell us
keep
your bad
checking.
habits.
Some days I'm unable to resist the urge to keep checking WhatsApp more frequently than I should do. Some days I would say I do binge watching, especially on Sundays, but I do binge watching, just finish something.
What do you watch? What's your
Well, I
go-to?
guess so. Yeah, so Netflix,
Netflix.
Amazon Prime, so TV shows, regularly movies. So of course that. I love food. So though generally I try to do intermittent fasting. Well, some days the resolution just goes for a toss, and then
Yeah.
one goes on a frenzy. But I would say that as well. So there are of course several bad habits. And
Those
by
are
the
my
way,
daily habits.
Yeah.
Everything
by
you
the way,
just said.
no, no,
WhatsApp.
no, by
WhatsApp is
no,
communication. That's
beyond
not
a
a bad
certain point.
habit.
Well, actually, in my medical college days and student days, I have had all my fair share of fights and everything. There was the engineering college close by. So medical engineering rivalry is always very well known. And medical college boys were somehow very protective of the girls from our college. So there would be confrontation on that issue also. So adequate tamasha I must have done in my own college days as well. So nothing.
Yeah. Uh, Dr. Anand, I have really enjoyed
Me too.
learning your story. I think not only you
Thank
but
you.
your family is amazing, and thank you for sharing the stories on Mahatma Gandhi. And yeah, I'd love to get to know you more in person. And next time in India,
Thank you.
I'll reach out.
Thank you.
Thanks a lot for doing this.
Dr. Anand, I wanted to say, and I'm not exaggerating. Our one of the goals of this podcast is to inspire and you sharing your story and your family story did just that. I am truly inspired by everything you guys are doing. Again, for everyone listening, the organization is called Search. And if you want to look more, look that up. They're doing phenomenal things for people in India. So thank you so much,
So
everyone. This has been another. Oh, go ahead. Go ahead.
no, I was going to say Sabrina is no longer going to go to Ambani's wedding if she's
No,
actually invited. She will be
I'll
joining
pass
you.
on my invitation to Amit, and I'll come.
I'll still go.
Thank you, everyone. This has been another episode of Indian Explorers, a truly inspiring one. We hope you enjoyed it. Thank you.
Ciao.